very crucial for our future. That is the role of youth in prevention, treatment, recovery, and policy making. My discussion of 10 minutes will be of two parts. The first part, I'll discuss about the role of youth, and the second part, I'll present to you the Global Youth Declaration. Firstly, I'll talk with why youth voices matter. Youth is the most vulnerable age group. Youth is at such an age of development where peer pressure, experimentation, and search for identity can make them susceptible to engage in risky behaviors, including the substance use. Youth has a unique insight into the challenges, the pressures, and the temptations they face, which adults, no matter how well-intentioned they are, they may not fully understand them. If you involve the youth voices, strategies can be made more impactful, more meaningful, more grounded to the reality, and more likely to be adopted by their peers and fellows. They can also offer innovative solutions to tackle the issues, from online campaigns to the community programs. Not only this, if you give youth opportunity to represent themselves on such platforms, they can effectively and accurately explain their perspective that what actually led them to such condition. That is, the root cause can be identified. According to the UNODC report 2021, 275 million people use drugs, 36 million people suffer from substance use disorders, while in the last 14 years, cannabis potency has been increased as much as 4 times. Not only this, the perception of risk has been reduced to 40 times in young adults. So it means the youth voice is really matters. Not only this, they have the ability to reach their peers more easily because they have the same mode of communication, experiences, and concerns. Now I discuss about the Global Youth Declaration. So last year at the 67th CND, side event was hosted by PYO, Drug Free America Foundation, and World Federation Against Drug on the topic role of youth participation for drug policy and drug prevention. At that point, the idea was sparked that a Global Youth Declaration should be created. If we talk about the process that how it was created, so SANA initiated some discussions with AMI and Presida, and the 3 organizations came on the same page that Global Youth Declaration is the need of the hour and it should be created. The core youth group was created and there were almost 15 members from the 13 different countries. And virtual youth core group began by discussing the youth engagement in their particular regions and countries. After that, it was decided that a survey would be done to map the youth engagement globally. We collaborated on developing the survey format, incorporating the suggestions from different groups, refining the survey, and then started disseminating. We extended the survey deadlines 2 times in order to engage maximum participation from the youth. Not only this, we translated the survey in 5 different languages for the same purpose that the maximum participation of the youth can be ensured. After that, we initiated the data analysis. After incorporating different feedbacks and suggestions from our core members, we finalized the analysis. Our survey basically consisted of 2 parts. One was the close-ended questions and one was the open-ended questions. The purpose of open-ended question was basically to find out the point of view what youth actually wants, that how they should be incorporated in such platforms. I will focus more on the open-ended questions to tell you about this. So there were, if we talk about the overview of a survey, there were 1,145 responses from 64 different countries. Yes, firstly I talked about the open-ended questions. So based on that open-ended questions, the answer which you gave, there are 6 recommendations, and I also give you some strategies that can also be implemented with how the youth can be included. So the first recommendation is actively listen to and involve youth. It includes the youth in program development and policy and decision-making processes at all levels by providing platforms for meaningful youth engagement. Now, how can this be done? The strategies include we can establish dedicated spaces for dialogue, create youth councils, include youth representatives in policy discussions. Not only this, we can organize forums, focus group discussions, and declarations in order to create an impactful youth voice. Not only this, a survey also said that 76.4% of the youth said that they are being misunderstood by the community and the societies about their substance use needs, And 75.4% of the youth said that there are very limited opportunities in the society if they want to engage themselves in such healthy activities. Next point is enhanced research and modernized risk awareness campaigns. We basically demand the member states and stakeholders to conduct comprehensive, youth-focused and gender-differentiated research and translate findings to modernized, sensitized and evidence-based awareness campaigns. So in this regard, we can do what? We can educate the youth on the risk associated with the substance use. A survey said that there is a significant reduce and decrease in the perception of risk, especially in the younger people. So what can be done? That special attention should be paid to the age less than 18 years to mitigate the adverse effects effectively. Next point is implement gender-responsive approaches to address the substance use challenges. So there is a need to develop gender-sensitive policies and interventions that acknowledge and are tailored to the unique challenges faced by the young people by all genders. A survey analyzed that there is an increased exposure to the substance use among females until 23 years of age rather than males. Why? Because in this age, females are more vulnerable to the mental health issues, economic pressures, and peer pressure, while the male experiences these things later in their life. So that is why there is a need to develop gender-sensitive policies. Next is ensure increased provision of improved and accessible youth sensitized services. There is a need to provide accessible, affordable, and sensitized treatment and rehabilitation programs designed for youth. So what can be done in this regard? We can increase the number of clinical psychologists established 24-hour service teams, and also we can create accessible hotline for immediate support and help. Not only this, we can also create a comprehensive reintegration and aftercare services in collaboration with youth organizations and emphasize holistic support systems including family involvement, peer counseling, and community-based programs. Number 5, empower youth through economic independence and leadership opportunities, support youth achieving financial independence, and foster leadership opportunities as key factors in sustainable prevention and recovery. What can be done in this regard? That we can establish accessible youth centers, form youth task forces, support youth-led initiatives and organizations. Also, we can encourage peer discussions and mentorship programs. Our survey highlighted that there is a critical need for youth opportunities as a key factor in youth well-being. Employment initiatives tailored to youth education and skill training must be prioritized. Strengthen policy support and policy enforcement. Enhance community-based programs including awareness-raising campaigns, capacity-building workshops. Establish and enforce comprehensive policies preventing substance use exposure. Now what can we do? What can be done in the policy making? Policies should include strengthening protection for minors and young adults against substance exposure, implementing ban of substance advertising, and ensuring that policy lawyers focus on drug traffickers rather than drug users. And drug users must be provided proper rehabilitative services and aftercare services as well. Now I would like to give my special thanks to Amy, Chantal, and Cressida for helping me out, for their general consideration and kindness, and for facilitating my visit to here. I'm really thankful to you all, and also to Rocio and Mulka. They were all there for me for all these days, helping me out because it's my first CND, and I really didn't know how to do this. They helped me a lot. Thank you. At the end, I would just like to say the fight against the substance abuse is a collective effort, and youth must be at the heart of this movement. Let us work together to create spaces where young people's voices are heard and valued, not just as the recipients of information, but as active contributors to the solutions as well. That will make their community safer and healthier. That's all from my side. Thank you very much for listening.
Thank you, Fuhaira. That was a wonderful presentation of the importance of youth involvement, but also the basically second launch of the Youth Declaration. For those that do have a phone, you can scan this code and you will lead to the website, but also we'll give some copies after you finish your lunch. So you have actually the Youth Declaration on a copy as well. I believe that I might be a little bit biased. I think it's a truly remarkable piece that has been put together with the input from 1,145 youth through a global survey and through purely based on analysis. I'll just move on to a little bit of notes that I'll give from my side, also with the Youth Declaration, based on the Youth Declaration, because as Fuhaira shared, there was a survey that was disseminated, so the Global Youth Survey on Prevention, Treatment and Recovery, and this also gave a lot of other kinds of empirical outcomes based on the quantitative questions that were asked. And I believe that these also should be considered when we work with our advocacy in promoting youth causes and issues, and to be more aware of what they are facing at the moment. Because this youth declaration as well as the outcomes is basically the translation of the loud voices of youth calling for engagement opportunities as well as life opportunities to combat substance abuse and safely grow into a healthy adulthood. So, as I said, it is based on the research, so it's based on the foundation of the declaration, it's based on the survey. So, I will give some insights. So basically, I want to start to say that this survey was disseminated thanks to the support of all our network organizations. And in the end, 1,145 responses were added in 64 countries, representing 64 countries. And I just want to share that we just removed a few answers because some of the answers were either AI interfered, they were duplicates, or they might have been against the principles of the youth core group. And also, before I go into it, I want to share that it's important to note that questions posed on the survey focus mainly on perceptions. So we did not, for example, ask whether the youth had used drugs for ethical reasons, but rather how they perceived use in their environment among their peers. So when going to the first point, we'll want to highlight the gender differences in perception and use. So as we know, it is essential to understand the existing gender differences, and the survey confirmed as well as revealed new differences in this aspect. So when it comes to exposure, as you can see on this graph, females and males are most exposed to alcohol and tobacco, and the graph kind of shows a similarity on this aspect. Significant differences emerge when looking at the specific types of substances encountered. Generally, we see a higher exposure of different substances among male and females, except for vaping. When it comes to differences in perception, we see a swap. So here we see that the so-called gender gap is closed because as this showcases, the higher the bar, the lower the perceived risk is. So you can see that the perceived risk is in every substance, it's lower among women than men. This is especially the case in some regions such as Bangladesh, Cameroon, China, Namibia, Sri Lanka, and Zambia. And we also do see clearly an exception of even a lower risk perception of youth among youth who did not prefer to share their gender, which should definitely be further researched and further investigated, as well as considered in our programs for more tailored responses. We also see that the challenges faced by males and females is clearly different as the age progresses, as per our survey, with females reporting greater challenges related to peer pressure and mental health compared to their male counterpart until the age of 23. There's also age differences in the use or perceived risk, among age. So the findings show that there's a causal connection between exposure and assessment of risk. For example, we see that as age increases, risk perception increases also, highlighting again the importance to include to provide prevention as early as possible. We also see that younger participants between 15 and 23 reported higher exposure to illicit substances. Older age groups, on the other hand, were more likely to report alcohol, cannabis, tobacco, and vaping as predominant substances. So almost all substances in the youth below 23 or below 17 are exceeding in the perception of use. We also see some Also connections between and correlations between perception of involvement and the effectiveness of programs and responses. So, for example, when it comes to government community involvement, we see that communities that actively engage youth in policy creation or program development tend to have a more effective response to substance use. Prevention programs in these communities are also perceived more impactful. Government involvement, on the other hand, we also see that when governments take an active role in substance use prevention and recovery, communities benefit from stronger support systems, including enhanced family and peer support. This suggests that government engagement reinforces community efforts, leading to better overall outcomes. Again, this is a perception that was shared by the youth. Finally, youth involvement itself, we see that youth who perceive their community as effectively engaged are more likely to see their own involvement in policy making as meaningful and attainable, so are more likely to do so as well. On the other hand, those who view community involvement as ineffective tend to distrust policies and their potential impact. Greater youth participation in policy and advocacy also correlates with an increased perception of risk across most substances, except illicit substances, where discussions often encourage debate and deeper engagement with the issue. So this kind of concludes that the roles of community government and youth are deeply interconnected. When all the three are actively engaged, youth feel more supported and are more likely to seek and receive help from families, friends, and the broader community, as well as involved into engagement, in government engagement. However, when one actor is disengaged, trust in the entire system declines, weakening the effectiveness of prevention and recovery efforts. So with that, I hope that you will not underestimate the strength of the youth, as well as the need to recognize them in the process, while also filling the existing barriers and gaps faced in the service provision to ensure that they can access the pathway of recovery or even prevent from being involved in substance misuse. The pathway of recovery, however, is not only to be supported for youth, but also for all populations. It is essential to remove barriers as well as stigma around recovery while establishing recovery communities. We know that recovery is possible, as it is showcased by science as well as persons with lived experiences. However, recovery is not self-evident, and supportive systems of care need to be in place. And with that said, I would like to present our next speaker, Mulka, who will be sharing an overview of the Global Recovery Position Paper, its strategic recommendations and action steps. She is a research officer at the Center of Hate Studies at the University of Leicester, sorry if I mispronounced that, and Secretary General of the Recovery Users Network and Chair of the Global Gender Committee.